Today, we are talking about another incredible, important topic. Let's start the podcast first.
You're
Hello, good
getting carried away.
morning.
We're in a rush here.
Good morning, good afternoon, good evening.
Whatever time you're watching this virtual reality headset, and whatever month it is on YouTube.
A year or a decade. I don't know how long YouTube is going to last, but as long as you're watching this and using this as information or, knowledge or I don't know, just
Welcome back to another episode of
spilling the tea with Dr. T, G, and Lavally.
Lavally.
We're getting there.
We're getting there. So welcome back. We're really excited today to be talking about a topic that we hear a lot about from our patients. Certainly a big reason why patients present to me with concerns for low testosterone. So I hope I don't miss anything. If you have additional questions that we don't cover, that this topic, springs to mind, please leave them in the comments below. Let us know. We'd love to answer those questions. If you have things to add, certainly do so as well. But yeah, it's going to be an interesting one. I hope I can keep up. There's a lot.
I'm super curious because this was definitely one of the ones that we get the most questions, and I'm sure there's a lot to explain and to inform us.
Yeah, let's get into it.
Yeah, let's get into it.
So the topic we're going to discuss today is, does body fat or an increase in body fat cause low testosterone? And this is, again, a really important topic. A lot of my patients present with this concern, and it's important to know that there is a bi-directional relationship between testosterone and body fats, meaning low body fat means typically your testosterone is on the higher end. High body fat means it's on the lower end. If you have low testosterone, it can cause an increase in body fat. If you have an increase in body fat, it can cause low testosterone. So there's a lot of arrows pointing different directions there. But most importantly, we're going to sort of talk about the relationship between how body fat can result in low testosterone. And so we'll start with the basics as we always do and move through. So keep patient with us as we hit some topics that may be a little bit simple. And then we'll dive into the more in-depth sort of explanations of things.
Let's start with the ABC.
Let's start with the ABCs.
What is exactly testosterone?
Right. So we've talked about this before, but it's always a good refresher. So this is the most important hormone that allows males to develop through puberty. It's going to help them to develop their sexual characteristics like body hair, facial hair, deepening of the voice, increase in lean muscle mass as we get older, as well as develop our sexual organs. And then as we go through puberty, it's also going to become very important with our mental health, things like developing and retaining memories, our concentration and focus, our mood, so making sure we avoid depression and anxiety, and then moving into our sexual health. It controls our libido, it controls our erections, it controls our orgasms, it controls how our body lays the composition for itself, so where it puts body fat, where it puts muscle, and how those metabolically active tissues remain active and using energy. And so a very important hormone that pretty much does everything we need to function as males and females too. There's a component in female health as well.
Very busy hormone.
Yeah, it gets around.
So that's the definition of testosterone, but what is the endocrine system?
Right, so the endocrine system is basically the entire organizational system in our body that regulates biochemicals, hormones, basically any chemical signal that goes from an organ to another place in the body. So it could be nearby, like an organ to a nearby tissue, or an organ to a faraway organ or faraway tissue. And so testosterone is a part of the endocrine system. It's a hormone. And why this is so important is because body fat, we used to think, was just some sort of storage cell, right? It would just hold on to the energy that we would use later. We would burn body fat to create energy, but now we're seeing that body fat cells actually are a part of the endocrine system. They release their own hormones and biochemicals. And so there is a balance between testosterone and body fat that is sort of like a fight back and forth, which can make us feel pretty lousy if our sort of battleground is too much body fat and not enough testosterone. We'll get into the details more about how the endocrine system is playing a major role here.
Interesting. There's so many important players in our human body.
Yeah, and the endocrine system is extremely sensitive to pretty much everything around us, right? So it's constantly reacting to stress, not only internally, but externally. So all the environment, any chemicals in our environment, any changes in the temperatures or the places we live. It's also constantly responding to the things we eat and the things we apply on ourselves. So it's, again, constantly sort of responding to the environment, and it's very fragile. So things that disrupt it can cause wide, consequences throughout the body.
And what is exactly body fat?
Great question. So body fat is also known as adipose tissue, is sort of the medical terminology, and it's created by cells that are specifically body fat cells, and it is mainly used, what we thought in the past, for storage. So when our body has excess fatty acids from food that we've broken down, it will store those fatty acids into the cell, allowing the cell to grow, and then it's kind of kept away until we need to use it, specifically in times when energy is needed for working out, running, getting through the day. There are certain parts of our body too that are more dominantly dependent on fat rather than sugar. So fat cells are initially, what we thought, mainly just storage sites. But what, again, we're seeing now is they're actually metabolically active and hormonally active. So they can release chemicals and cause changes to the environment near them as well as throughout the whole body. So very complicated cell for something we thought was just, a storage facility.
Wow. It has a lot of different functions and different
Exactly.
role
Consequences.
consequences.
Testosterone is produced in the gonads or the testes of the male, but it doesn't quite start there. The whole process actually starts in our brain in an area called the hypothalamus. The hypothalamus sends a signal to the pituitary gland, which is really close in the brain to the hypothalamus. Then the pituitary gland sends some signals to the testicles, which is quite far from your brain, as you can imagine, and then the testicles start to produce testosterone. And this is what we call the hypothalamic pituitary gonadal axis. So
Wow.
quite a complicated name, and just as complicated as the name, the system is extremely sensitive. So any sort of disturbance that happens to us chemically or really everything in the body is releasing some sort of chemical, right? So a physical sort of stimuli or something we eat or emotionally, everything inside is happening chemically. So any of those chemicals can cause a disaster in this sort of very fragile system. And what we know about fat cells is that they can heavily impact how the sort of system is processing and ensuring that testosterone is produced adequately. So we happen to know that fat cells release these chemicals. They're called adipokines. Adipokines.
Adipokines.
Adipokines.
Adipokines.
Yeah, so anything kines is typically like a signaling portion that's released from a cell. Anyway, so adipokines are coming out of the adipose tissue or the fat cells, and they actually go to the brain and disrupt the release of certain stimuli, specifically LH, luteinizing hormone, and FSH, follicular stimulating hormone. And these are what go to the gonads and say, hey, wake up, let's increase testosterone production. So we happen to know at that area, fat cells are already inhibiting the normal testosterone flow. Secondary to that, fat cells contain an enzyme called aromatase. So aromatase, like the name says, aromatizes or acts on testosterone to convert it into estrogen. And so this is the female hormone that we do need a small amount of. Estrogen is important for our skin health, our libido, our immune system, but we need it in a very low amount. And the ratio
Ah,
to testosterone needs to be quite specific. It needs to be high testosterone, low estrogen. So the more fat cells, the more active that enzyme is going to be. So it's going to be shuffling testosterone that's produced in the gonads over into estrogen and leaving our testosterone low. That has wide scale effects. Not only is that going to further prevent your testicles from wanting to make more testosterone, but it's also going to cause your body to want to increase fat production and many other consequences. So testosterone, again, is produced in the gonads from this very delicate system where fat cells have many opportunities to sort of delay and disrupt that system,
it's all connected in our body.
unfortunately.
It's almost like one depends on the another, and the amounts need to be specific. The estrogen in man cannot be too high, otherwise, what will happen if it's if higher than normal?
So when the estrogen is too high in our body, we start seeing things function improperly. So initially, you're going to see a decrease in testosterone production that's naturally occurring. You're also going to see the potential for side effects like a decrease in your libido, erectile dysfunction, increase in body fat, a decrease in lean muscle mass. You're also going to be concerned for something that can happen if your estrogen gets too high called gynecomastia, the development
Mm.
of breast tissue under the nipple. Not only is estrogen going to promote adipose tissue or fatty tissue to go into the hips, into around the belly, and certain areas of our body that typically would be more seen in females. It's also going to encourage fat to be deposited underneath the nipple, creating breast tissue.
Wow.
So typically, this is why we see men who are obese developing breast tissue under their nipple. It's not because the fat is just going there because that's another place to be.
It's
Typically, we don't
estrogen.
store fat there, right? It's more for females, but because their estrogen level is increasing, fat can be deposited there. And that's not every person with gynecomastia. It is one of the main causes, but of course, we don't want a blanket statement that everyone who has gynecomastia has an estrogen problem, but it is a very common cause, especially in obese males.
Wow, crazy. We need some estrogen, but not a lot. A
Exactly.
little bit.
Very delicate balance. Everything in our body, of course,
Interesting.
is a very delicate balance.
Do fat cells release any other chemicals that we should know about?
Yeah, so one really powerful chemical or signal that fat cells release is something called leptin. So leptin is actually a really helpful signal that tells your brain to reduce your appetite. So in the body, when you have a lot of excess fat cells, those fat cells will start to release something called leptin. Leptin will
Mm,
go to your brain and say, hey, we're full. We have lots of storage. You don't need to eat anything right now because we got plenty here. We can burn this energy later when we need it. The problem is when you are trying to use leptin naturally to reduce your appetite, like your biology wants you to, we're combating foods and snacks that we eat in the 21st century. This is sugar everywhere, right?
right.
And beyond leptin, this very powerful chemical that comes from fat cells, there's nothing stronger than sugar. Clinical
Wow.
evidence shows sugar is the most addictive substance on the planet, right? So you don't have a choice. You can't even
Escape.
really allow for leptin to have a chance here, right? In biology, leptin is supposed to reduce our appetite, but what also happens unfortunately is the more fat cells you have, the more leptin that is released, and the more leptin is released goes to your brain and says, "Hey, reduce your appetite." And think of it like this: if you had a loud noise in the background that, did something really loud, and maybe once an hour you'd be like, "Whoa, that is very annoying. I need to respond to that." But if you had it making that noise
You're gonna
constantly,
ignore it.
you're going to ignore it. You get used to it. And that's exactly what happens with leptin. It's just pressing this signal over and over in your brain. And your brain basically just pretends like it's not there anymore. Very similar to what happens with insulin and diabetes. So, insulin tries to move sugar into your muscles, but because there's so much insulin trying to move the
Mm,
sugar, your muscles are like, I don't even know it's there. And then you have diabetes develop and sugar goes unchecked in the blood. So, leptin doesn't cause diabetes, but similarly, these chemicals are being overstimulated due to excess sugar or excess fat, and that's causing consequences.
poor leptin.
Didn't stand a chance.
Sugar is just too powerful.
I mean, you're telling me I love sugar.
Good explanation. I feel like this is very insightful.
You think so?
Now I know all about the leptins and the
The
body
leptins and the
fats.
aromatases and the adipokines and the body fats and the
Wow.
fatty acids and the
Feels
all of
like I'm
it.
back in high school.
That's good. I hope in a good way. I didn't
In the best way. I
the
loved high
best.
school.
Well, you were a nerd.
I was. I love to learn.
I
However, I have to confess. Confessed?
I must confess.
I must confess. In high school, I learned all of this though. Most of those things that we were talking about, obviously,
Wow.
not like deep into testosterone and all those things, but my least favorite subject in biology was human biology because I
Wow.
never had a good teacher.
It's all about the teacher.
Yeah, like every teacher that we had that taught us human biology was not not the right person. I feel like we're the right person.
I think I stopped having good teachers after like sixth grade. I never really connected
Yeah.
with any of them, which probably is the reason I didn't like school. But I loved me some elementary school.
Are there any other harmful effects that we should know about body fat?
So another problem with body fat cells is they release a lot of inflammatory markers, especially if there's a lot of body fat. And the problem with the inflammatory markers is that typically your body's going to respond with white blood cells and an immune response to try and target some sort of damage somewhere. So you're getting your immune system all wound up and it's looking for something to create, a response for, and there's nothing there. So then your immune system is constantly using your energy and becoming sort of irritated around the
Wow.
area that those response sort of markers are being released by the fat cells, and they don't just happen locally, right? So this is going to happen throughout the body. Those markers get into the bloodstream, and then you have an inflammatory response throughout your whole body. This is why we see an increased risk of inflammatory diseases if you have an increase in abdominal fat or body fat in general. And so we're seeing patients have an increased risk for high blood pressure, kidney failure, diabetes, cholesterol increases, and atherosclerosis. And so all these things are related in a way, you know, as far as the fat cells continue to release these problems into the bloodstream, creating more and more of a sort of disaster, you know, space waiting for the body to try and clean up the mess.
Wow. It's all related.
And this is again too why there's so many chronic medical conditions linked to obesity. And we are seeing that there are some people who have an increase in body fat that are still living long, normal lives, but they still technically, if you look at statistics and look at sort of
Numbers.
the numbers, they're still at an increased risk of developing these conditions. And so, you know, there is this sort of back and forth as we don't want to body shame people or
All
to
right.
shame people out of obesity. You know, it's just about living as healthy as possible. And there is a strong genetic correlation to holding body fat. And that is certainly not the point of this topic to create any sort of disheartening, you know, approach to that. There's a lot to be said for battling obesity. It's just the facts, and the facts are that there is a statistically higher
The
risk
chances.
of developing, you know,
Yeah.
certain diseases, especially things like low testosterone, if your body fat is unchecked.
Yeah, that doesn't mean if you have lower body fat that you won't develop any of those diseases. That can happen either
Exactly.
way.
Exactly. So all the people that don't have high body fat can still be at risk with high blood pressure, diabetes, kidney failure, all of these things. It's just statistically lower. So if you're trying to avoid all of the risk factors involved, this happens to be one of them.
Everyone is at risk, but we should
Right. Exactly.
know the numbers and the facts and statistics.
Yeah, and that's, you know, we're just nitpicking here.
So, what is exactly the role of testosterone in metabolism and body fat distribution?
Right. So testosterone plays a crucial role in regulating our metabolism. It's one of the most important factors in regulating something we call the basal metabolic rate, which is the rate at which we burn calories at rest. But it's also the main factor, especially for men, in determining how fast we're burning sugar and burning fat. So it's in charge of something called glycolysis, so the breakdown of glucose, as well as lipolysis, the breakdown of lipids or fats. So that being said, testosterone, of course, being responsible for breaking down body fat, is also responsible for making sure body fat is put where it's supposed to be. And so we do have two areas of the body that body fat is mainly distributed. So that's subcutaneously, or right underneath the skin, as well as viscerally. And so that's around the organs. We need a small amount of fat in both of those areas. So we need the smaller amount of fat around the visceral organ area because that provides cushion and support to the organs, as
Mm.
well as the similar situation around the subcutaneous tissue. We need some support and some cushion around all of our muscles and to help just our natural structure. The problem is if your testosterone is suboptimal or low, you're going to see an increase in body fat in both of these areas. More concerning, we see it in the visceral fat area where disease is more likely to be at play. We do know there is an increased risk of chronic disease when your visceral fat is increasing,
Wow.
and more so dangerous than the subcutaneous fat that's right underneath the skin.
And what is exactly this visceral fat?
Right, so visceral fat is going to be the deeper intra-abdominal fat that is lining the organs, creating support and cushion between them. But the problem is if this gets too much or too large, it can almost suffocate some of those organs. And also because of these fat cells being inflammatory and having all of those chemicals that they can release, imagine the fat that's closest to these organs, if they're constantly releasing inflammatory markers, it's going to create inflammation in your pancreas, in your heart, in your lungs, in your liver. And this is what leads to chronic disease and why visceral fat can be so dangerous.
Wow, that's alarming.
Yeah. This is what also people can often refer to as skinny fat. You
Uh-huh.
know, people who eat a large fat diet or a lot of processed foods, they still look
Mm.
skinny, but they'll go and have a scan done and their body fat is
Wow.
high. And they're like, I don't know how I have high body fat. I'm so thin, or they're, you know, difficult to understand that. It's because the visceral fat or that skinny fat, which is deep inside, is high and much more likely to cause disease than that
Wow.
subcutaneous fat.
That's crazy because you think the one that you can see is the one that it's the most harmful to your
Right,
body.
right. Science.
How can I measure this skinny fat?
So you can go to a GNC or to a place that you know has like a body scanner. While a lot of those are not super accurate, they can give you a rough estimate of what that looks like. The most Valid and best way would be to have a DEXA scan, and there are some places that do that. It's a bit more expensive, but the DEXA scan will tell you exactly how much body fat you have, especially visceral body fat. So I specifically would recommend, if you are really concerned about how much visceral body fat do I possibly have, a DEXA scan is the way to go.
DEXA scan. So how do we know if there is a link between low testosterone and low body fat?
Right. So everything is clinical evidence based, right? So, of course, we can say this is what it looks like and we can take our own sample sizes, but we need to know in general, what is the actual population responding with? What does the data look like? And so, luckily, we have a lot of clinical data that has been done, meta analysis studies where they're double blinded. So, basically, the people who are in the study as well as the people who are conducting the study both are blinded to who is actually getting the treatment versus who is not. And the evidence is clear that those that have low testosterone are at an increased risk of developing body fat. Those that have an increase in body fat are at an increased risk of developing low testosterone than those that have optimal or even normal testosterone values. One of the best journals to look at is actually the Journal of Clinical Endocrinology and Metabolism. They have a ton of evidence to prove that there is a strong correlation between our hormones and our fat levels.
I need to read some of that.
I think you're fine.
So, can testosterone replacement therapy improve body fat?
Again, another great question. If you have suboptimal testosterone or low testosterone, there is clinical evidence to show that optimizing that value, getting you in the normal or higher range, is going to improve the body fat distribution and increase lipolysis, or the breakdown of body fat. So it's interesting. The clinical evidence has shown it, but I've also seen it in my own patients. And I have some that actually are immobilized in a wheelchair or not able to work out. And so they come to me thinking, will this change any of my metabolism? Am I going to be able to lose weight with starting TRT, even though I can't exercise? And of course, the most benefit you're going to see is by adding physical activity, but by just optimizing your testosterone values, there is clinical evidence to show that you will reduce body fat and increase lean muscle mass. So there is a strong correlation that that treatment will help. Of course, if your testosterone values are low, deficient, and you are applicable for treatment.
That's great. That's great news.
Yeah.
For people who are interested in seeking treatment.
Yeah. And of course, it's hard to lose body fat. So finding ways that can improve that is always going to be beneficial for patients.
So how exactly does testosterone impact our muscle mass and our fat use?
Right. So testosterone is going to stimulate your muscle cells to become more metabolically active. That means they're going to be using more energy even when at rest, but certainly even more so when you're exercising or using your muscles. So those muscle cells are going to be hungrier and requiring your body to break down more sugar and more body fat so that they can feed themselves. So ultimately, increasing your testosterone value, if it's suboptimal, is going to have a major impact on making that muscle more active and reducing body fat by cutting it down into energy so it can be processed in those muscle cells.
Does testosterone prevent or reduce fat growth?
Yeah, so for patients that have low testosterone, increasing that testosterone is not only going to shuffle the fat that they already have into the muscle cells, as those muscle cells are metabolically active and needing more energy. It also prevents something called adipogenesis, which is basically the formation of new fat cells, and it focuses on trying to increase lipolysis, so the breakdown of fat. So basically, higher testosterone values prevent fat growth and increase fat breakdown.
Adipogenesis. That's a good drag name.
Absolutely. One word or two?
Two. Adipogenesis.
Genesis.
Of the family of the Genesis, the dynasty of the Genesis.
Is that going to be the House of Lavali?
Lavali Adipogenesis.
Perfect. The House of TRT.
Is testosterone replacement therapy alone beneficial to decrease body fat?
For patients that have low or suboptimal testosterone values, just starting TRT alone has been clinically proven to reduce body fat, mainly by the mechanisms that we talked about. Testosterone is going to increase the breakdown of body fat and reduce the creation of new body fat. That being said, if you want the most benefit out of being on testosterone replacement therapy, you should certainly consider adding in a weightlifting routine or some sort of exercise, as that's going to really help to optimize those muscle cells to increase even further their metabolism. So you're seeing a more fat loss occur, but some people are immobilized or they just don't like to work out, and that's okay too. So there will be improvement with TRT alone, but I always recommend adding in at least some sort of exercise is going to help to really exponentially enhance those results.
Obviously, dietary changes.
Right, dietary changes too, of course. Absolutely.
It's crucial.
Yes, it all starts in the kitchen.
Yes. Can losing weight or reducing body fat lead to an increase in testosterone levels?
Absolutely. So if you're working on your diet and you're working on an exercise routine and trying to lose weight, trying to lose body fat is a great initial step towards trying to improve your testosterone values. The problem is it can be a little tricky because what came first, the chicken or the egg? Was it the low testosterone that caused you to increase your body
Right.
fat? Was it the body fat that caused you to result with low testosterone? But ultimately, there's definitely no problem with trying to improve yourself in any way possible. Of course, trying to lose weight and lose body fat can result in increasing those testosterone values, which then make your muscles more metabolically active. They're more responsive to exercise, which then makes losing weight more easy. So certainly give it a try. See if this is a problem for you. A diet and exercise are a great place to get started.
Is low testosterone common in individuals who struggle with obesity?
Yeah, so clinical evidence has shown us that about 50% or more of men that have obesity also have low testosterone. So we know there's a
Mm,
tight correlation there. So if you are considered obese or worried about your weight and you're experiencing symptoms of a lack of sex drive, poor concentration, a difficulty with strength or endurance in the gym, you feel as though you're experiencing some symptoms of depression or anxiety, any of these concerns that could be related to low testosterone, it's important to talk to your doctor and consider getting screened, as it could be an easy way to at least catapult your success out of obesity and help you to lose some of that stubborn body fat.
I think it's time to talk.
To talks?
To talks.
It's time to talks. If someone comes up to you and says it's time to talks, you know they mean business.
It means multiple talks.
Business.
Talks, plural.
And it's time to talks.
Talk about misconceptions and myths about body fat and testosterone and the relationship of both.
And there's a lot of them, but
I
we'll
know.
just do a few because we don't have all day.
And our viewers too are bored.
Busy. Y'all are busy.
Yeah. They're like,
They got things to do.
yeah.
Speed it up.
They made it this far, so they're like, oh my God, I just want to finish because
I'm already here.
I'm already here at this point. Is it true that only overweight or obese men experience low testosterone?
Absolutely not. So low testosterone can happen to anyone, whether they're a professional athlete, whether
Wow.
they are obese, whether they're anywhere in between, whether they are 20 years
Young,
old,
yeah.
75 years old, or older. So there's no limitation on who you are. Testosterone does not discriminate in regards to age or weight or body type. We do just know that men that are obese, they're at a higher risk of
chances.
developing low testosterone.
Is it true that low testosterone is solely responsible for increasing body fat?
Absolutely not. So we know this is mostly, of course, going to be a major factor in men. So women aren't going to have a low testosterone issue causing their increase in body fat. And body fat is multifactorial. There's many different things that be contributing. Again, we just happen to know that men that have obesity are at an increased risk of developing low testosterone, which can further worsen their obesity and make losing weight, especially body fat, more difficult.
Is it true that increasing your testosterone levels through testosterone replacement therapy will automatically decrease body fat?
A great question. So certainly testosterone replacement therapy and optimizing your testosterone values is going to make it easier for you to lose body fat. And there can be some body fat that is lost by just optimizing your value. Everyone responds a little bit differently, but typically if you want to see substantial change, you're going to want to make changes in your diet. You're going to want to start an exercise routine. Or if you're already doing those things, I always recommend start TRT, see how your body responds first, and then make adjustments to catapult on those benefits and on that weight loss.
So those are all the questions that we had for today, and I think I learned a lot with you, and those were great things to learn about body fat, testosterone levels. Another topic and subject that we were very excited to talk about, and thank you for answering all those questions.
Of course. I'm glad I got to talk about it with you and of all of you out there. And certainly if you have additional questions, that's what we're here for. So please leave them in the comments. Add any concerns or any things that you've heard through the grapevine or any ideas about this topic there as well. We'd love to hear your feedback.
Yes.
And certainly this again is meant to be a place of no judgment. Obesity is a very difficult journey to go through, and we are not trying to cause any shame or harm in that process or add any more to it. We certainly hope that this was in some way informative and supportive. But yeah, I think you're supposed to like, subscribe, send us vibes, carrier pigeons, screenshots, drop a pin, Yelp
Do whatever you
review.
want to do.
Do whatever you want to do. Do you. But please join us again next week because it's been a lot of fun, and we hope to continue providing you some fun educational tidbits on sexual health and health related topics. And we look forward to seeing you then.
Please send us some questions or recommendations. And yeah, see you next time.
Testosterone is the male dominant sexual hormone. Whoa, some country came out there. The male dominant